Before we begin, a quick note. The opinions and analysis shared on Truth Seekers are our own interpretations of published research and should not be used as medical, financial, or professional advice. Always consult qualified professionals for decisions affecting your health or well-being.
And with that out of the way, welcome to Truth Seekers. I'm Bill Morrison.
And I'm Alex Barrett. Today is December 24th, 2025, and we're talking about
Let's get to the truth. The blood test that catches 90% of Alzheimer's cases. Or does it?
right. So imagine your parents been a bit forgetful lately, and you see this headline. Blood test catches 90% of early dementia cases. You'd be ringing the doctor immediately, wouldn't you?
Oh, absolutely. That's exactly what happened last summer when this story went everywhere. CNN, NIH, Alzheimer's Association, everywhere. All reporting on this Nature Medicine study about a blood test with 90% accuracy for Alzheimer's.
Which sounds brilliant. A simple blood test instead of all those expensive brain scans or that horrible spinal tap they do to check your spinal fluid. Just pop down to your GP, get some blood drawn, know if you've got Alzheimer's.
Right. And I want to be clear up front. This is real science. The 90% figure is accurate. But when I actually read the study, I had this moment of wait, who exactly were they testing?
Oh no, that's never a good sign when you start asking that question.
Yeah. So the headline said this test catches Alzheimer's, right? Like it's going to identify the disease early in regular people. But here's what the study actually says, and I'm quoting directly. Main analyses were focused on individuals with cognitive impairment, mild cognitive impairment, and mild dementia.
Hang on. So these weren't just random older adults getting a routine screening?
Not even close. These were people already being evaluated for cognitive symptoms. They were recruited from memory clinics and primary care offices specifically because they were having memory problems. The Swedish cohort had 720 people with cognitive impairment. The US cohort, 50.
Wait, 50 people in the American validation group?
50 with cognitive impairment, yeah. So the bulk of the data comes from Swedish specialty memory clinics.
50? That's tiny for a validation sample, isn't it?
It is small, yeah. The Swedish cohort is much larger, but for the US validation, it's 50 symptomatic people.
Okay. Okay, but what I'm still stuck on is that's completely different from what catches early dementia implies. When I hear catches, I'm thinking it finds the disease before you even notice symptoms, like how a mammogram can catch breast cancer early.
Yes, exactly. And this is the critical distinction that got lost: diagnosis versus screening. This test is accurate at diagnosing what's causing dementia in people who already have symptoms. It's not identifying pre symptomatic disease in healthy populations.
So, if I'm understanding this correctly, the test is quite good at saying your memory problems are caused by Alzheimer's pathology versus something else, but it's not out there finding Alzheimer's in people who feel fine.
Right. And this matters enormously for how accurate the test actually is in practice. When you're testing people who already have cognitive symptoms and are being evaluated in specialty clinics, the prevalence of Alzheimer's pathology in that group is really high, 50 to 74% in these cohorts.
Because you've already selected for people likely to have it.
Exactly. That enriched prevalence affects the predictive value of the test. The same test used to screen healthy people, where Alzheimer's prevalence is much lower, would have very different performance characteristics.
Wait, didn't we just cover something like this? The smartwatch thing?
Oh, yeah, the heart function study. Same issue. Hospital population had way higher disease prevalence than general screening would.
Right. So the accuracy numbers look great in the clinic, but might not hold up when you're testing people who aren't already showing symptoms.
Exactly. And the study itself acknowledges these results need confirmation in broader populations for cognitively unimpaired people.
So the 90% accuracy might not hold up if you're testing someone who's not showing symptoms.
We don't know. That's not what this study tested. And here's what really gets me. CNN's headline was Blood Test Catches 90% of Early Dementia Cases. But catches implies prospective identification. This was a retrospective study of people already under evaluation.
God, this is frustrating because I can absolutely see how families would interpret this. My grandmother had Alzheimer's, and if I'd seen that headline, I'd have thought, brilliant, I can get tested now and know if I'm at risk.
And that's not unreasonable. The headlines created that expectation. But the study explicitly states the population they tested is the target population for available disease modifying treatments, meaning people who already have symptoms and could potentially benefit from drugs.
What about that comparison that was everywhere? The one saying the blood test was 90% accurate, but doctors were only 60 to 73% accurate.
Oh, I'm so glad you brought that up because that comparison is incredibly misleading. How so? So, the study compared the blood test against doctors who were using only a clinical exam, brief cognitive test, and a CT scan. No biomarkers at all. But that's not the current standard of care. The real comparison should be how does this blood test stack up against existing FDA approved tests? And the study's own words plasma p tau 217 was clinically equivalent to FDA approved CSF tests. Not superior, equivalent.
Hang on, so it's not outperforming the existing standard, it's just potentially less invasive than a spinal tap.
Exactly. Which is genuinely useful. If you're a patient who needs diagnostic testing and you can do a blood draw instead of a lumbar puncture, that's real progress. But the headlines made it sound like this was superior to everything doctors currently have, and that's not what the data shows.
Okay, but I'm going to push back a bit here because even if it's equivalent to existing tests and less invasive, that still seems quite valuable. Like, that's actually meaningful progress, isn't it? Why are we being so critical of this?
No, you're right, it is meaningful progress. I don't want to dismiss that. The less invasive aspect matters a lot for patients. I guess what I'm frustrated by is the gap between what the research actually shows and what people think it shows based on the headlines.
Right, but the research itself is sound.
Yeah, the research is solid. The researchers were careful about defining their population and acknowledging limitations. It's the translation that's the problem.
Okay, so assuming someone does have symptoms and sees a specialist, why are we not seeing this test in doctors' offices yet if the study came out last summer?
Because there's a massive practical barrier nobody mentioned in the headlines. The 90% accuracy requires mass spectrometry.
I'm going to need you to translate that.
Mass spectrometry is expensive, specialized laboratory equipment. The study itself acknowledges these systems typically have higher cost per assay than immunoassays, and the corresponding analytical platforms are also less widely available and require more technical and operational expertise.
So it's not like checking cholesterol levels where any lab can run it.
Not at all. And here's the kicker. There's currently no FDA approved mass spectrometry p tau 217 test. This is still in the research phase.
But the headlines made it sound like this was ready for primary care offices next year.
Yeah, they really did. And there's one more issue that's particularly relevant for primary care populations: kidney disease.
How does kidney disease factor in?
The study acknowledges certain comorbidities, especially kidney disease, can lead to false elevations in plasma p-tau levels. They tried to account for this by using ratios instead of absolute levels. But independent research published just this year shows chronic kidney disease still significantly confounds the results.
And kidney disease is pretty common in older adults, isn't it?
Very. So, if you're thinking about deploying this test in primary care, where you'd screen older patients who might have kidney disease, cardiovascular disease, other conditions, the accuracy might not hold up the way it did in these carefully selected research cohorts.
Hmm. And that's before you even get into the prevalence issue we were talking about earlier. Right, this is one of those cases where the science is real, but the translation completely missed the mark. The researchers seem to have been quite careful about defining their population and acknowledging limitations.
Absolutely. The Nature Medicine paper is very clear about who they tested and what the findings mean. It's the headlines that stripped away all that context.
So, what should people actually take away from this? Because I don't want to suggest there's no progress here.
Right, and there is genuine progress. If you or a loved one are experiencing cognitive symptoms and being evaluated by a specialist, this blood test could potentially replace more invasive or expensive diagnostic procedures. That's meaningful.
But it's not the screening breakthrough for healthy people that headlines suggested.
Not yet, and maybe not ever for that purpose. The study simply didn't test that. What we have is a tool that's accurate for diagnosis in symptomatic patients, which is valuable but different from early detection in asymptomatic populations.
And it's not available in your average doctor's office because it requires specialized equipment and isn't FDA approved yet.
Correct. So if you saw those headlines and thought, I should ask my doctor for this test, the answer is going to be, it's not clinically available yet.
What kills me about this is the false hope it creates. Alzheimer's affects millions of families, and when people see 90% accurate blood test, they're imagining something that could tell them years in advance whether they're at risk. That's not what this is.
And that's the real cost of imprecise science communication. The underlying research is solid. These scientists did careful work and reported it honestly. But the translation into headlines collapsed critical distinctions that completely changed what people thought the test could do.
So the question to ask when you see these headlines is, who were the participants? Were they healthy people being screened or symptomatic people being diagnosed?
That's exactly it. Because a test that's 90% accurate in specialty clinic patients with cognitive impairment might perform very differently in a general screening population. Those are fundamentally different clinical scenarios.
And apparently also, where can I actually get this test? Because groundbreaking study doesn't mean available at your GP's office.
Right. There's often a massive gap between research findings and clinical deployment. This study is from July 2024, and we're now in 2025, and there's still no FDA approved version of this test using the mass spectrometry method that achieved that 90% accuracy.
Is there any universe in which this does become a screening tool for healthy people?
Maybe, but that would require completely different studies. Prospective, longitudinal research following cognitively unimpaired people over time to see if the test predicts who develops symptoms. That's not what's been demonstrated yet.
Right.
That's a much harder study to do. You'd need to follow people for years, potentially decades.
Yeah, I hadn't thought about that. You'd be waiting to see who actually develops symptoms. Exactly. So if someone's watching their parents struggle with memory and saw these headlines last summer, what should they actually know?
If your parent is having cognitive symptoms, talk to their doctor about evaluation. There are diagnostic tools available, including biomarker tests, though this specific blood test isn't FDA approved yet. The research is promising for making diagnosis less invasive in the future.
But it's not a way to test yourself if you're worried but not symptomatic, not based on current evidence, no. And I think that distinction is the heart of this whole issue. The difference between I have symptoms and need diagnosis versus I'm healthy but want to know my risk. Headlines treated those as the same thing. Science says they're very different. And that difference matters enormously when you're talking about millions of families making decisions about their health.
Absolutely. This is real scientific progress for diagnostic medicine. It's just not the screening revolution headlines promised.
Which, I mean, diagnostic progress is still progress. I don't want people to hear this and think, oh, it's worthless.
No, definitely not. If this eventually gets FDA approval and becomes widely available, it could genuinely improve the diagnostic process for people with symptoms. That's not nothing.
It's just not the thing that lets you test yourself at 45 because your mum had Alzheimer's.
Right. That's the test people wanted based on the headlines. It's not the test they actually studied.
Right, that's all for today's dive into the data. Just remember, everything we've discussed is our interpretation of published research and shouldn't replace professional medical advice.
Absolutely. If you're dealing with health or mental concerns, talk to your doctor, not just us data nerds on a podcast.
I'm Alex Barrett,
And I'm Bill Morrison
and we'll see you next time.
on Truth Seekers.
Until then, question everything.
But verify with data.